Primary care is changing in that patients are living longer and with more complex illnesses, and increasingly these illnesses are managed in the community. And traditionally people came to the doctor to see some with their illnesses at a general practice, but that doesn't need to be the case, because we have an increasingly diverse range of health professionals who work in general practices, and not everybody who comes to the doctor needs to see a GP. So it may be for a particular complaint the most appropriate person is one of the nurses, for example things like their diabetes care or their asthma care, or if somebody has an acute problem like a chest infection, then it might be one of our primary care practitioners who's the best person for them to see. And what that does, it gives us flexibility in how we can manage our patients, and it also frees up time for the general practitioners, the doctors, to be seeing the more complex cases and managing those.
Here at Haxby we're introducing a whole raft of different changes, but perhaps one of the key changes is what we're doing with our workforce. We're bringing in a whole range of different clinicians to support the doctors in delivering the high quality care we strive for our patients.
Okay, so as an advanced practitioner, I have more advanced skills, so I can see patients, I can make a more advanced assessment and examination of the patients, and I can diagnose and manage and prescribe for that condition independently from a doctor. I do have a doctor available who supervises me, and there's always a doctor on site, so if there's anything I wasn't sure about, I can ask the doctor, or I can arrange for the patient to be seen by a doctor if needed. But the majority of the time it's something that as an advanced practitioner I can manage independently.
Most of my day is spent sorting out prescription requests and managing prescription requests that have come in from patients, be it recent discharges from hospital where medication might have changed, recent outpatient appointments. Any medication that a patient is requiring that needs review, I look at the prescription, I look at the patient's notes, and I look to see if they have had the necessary checks recently for it to continue, or whether they need to come in for an appointment.
Well, I think here at Haxby we're very well aware of all the challenges that's faced by primary care at the moment. And by challenges I mean there are difficulties, issues in our workforce. We're finding it more and more difficult to recruit GPs. Also, we're finding that our workload is going up. And again, this is not to complain, it's just a fact really that we're having increased numbers of consultations. I think since 2005 the number of consultations that take place in general practice has gone up by 60%. We're also finding that we're doing a lot more paperwork, dealing with letters from hospitals and blood tests and other test results. So our workload really is increasing.
Well, I would hope that patients will accept the changes with pleasure, I think, because the improvements are for the benefit of the patients and to free up time of the professionals to deal with the specific areas in which they're responsible. No, I'm quite happy to see the professional if it's appropriate for the query that's going on. We have blood nurses now, we have a travel nurse, we have a pharmacist. Yeah, why not?